we did not wear mask. We could face to face talk to each other, but now we have to wear mask. And actually, Dr. Chen is a very busy doctor. He usually on Wednesday he's quite busy, but today, because he wants to share the humanistic spirit of CG medical service, medical mission, so he had to arrange his time to share his experience here today through internet. And some people say that it was very rare to see Dr. Chen smile, but when he came to the after he worked in CG, he had witnessed suffering, and he now become even more gentle, even gentler than before. And now you quite often see his smile, and he and also so because I want to interview him, so I have to do research on Dr. Chen. And I found out that I respect him quite. I look up to him quite a lot because he is a role model to all of every one of us. And he is very courageous that he, in Dalin City Hospital, he received patients that are rejected by other hospitals because the severe illness. Other hospitals might not wanted to take the risk, but Dr. Chen, he's just so kind, and he opened the door to receive the patients. So the patient's family were very touched by his. And I felt numbness in the. There's a tumor in his brain, and it's very rare to have symptoms, and it would affect the motion nerve on her face. And now after the operation surgery, the patient gained the health back, and Suya is very grateful to the care of the medical staff, and now walk out to the community. This patient is very grateful that she gained back her health, and because of Dr. Chen. And we see that in Dalin Hospital, and they took good care of patients. They pay attention to very little details during the pandemic outbreak. We try our best to lower the infection rate of medical professions, and we hope that our preparations in the hospital will be able to protect our patients from infection. And this is a this is a dentist operation, and there's a and this tumor will follow through the nerves on the seventh pair of the nerve, and this patient would feel the numbness and the teeth, the toothache, and also the drools, and also the trigeminal nerves. And let's say again, let's welcome Dr. Chen. He is a very handsome doctor, Dr. Chen, from Tzu Dalin Hospital. He is the neurosurgeon in Dalin Tzu Hospital. Can you hear me? Hello, everyone. And I'm very thankful that that Sister Main, that she researched on me to get to know me. I appreciate I have this opportunity to be able to meet with all of you, Mr. and Mrs. Boys and girls online. It's my pleasure to meet with all of you. And we can use this new technology to share my experience with you online through internet. My name is Chen Jincheng. I'm the neurosurgeon in Taichung Tzu Hospital, and we are. The last time I was here to share the spinal surgeon, but this time I'm going to share with you the cranial surgeon. And the first case was he is a Mr. Xi from Malaysia, and his memory fading, and his family thought he is suffering from the dementia. After he went through the clinical exam, and doctor found out that he did not have dementia. He has a tumor in his brain for about 3 centimeter large dimension. And he lived in Malacca, and he went to all the various hospitals in Malacca, and no doctors could help him. And he also traveled to Penang, and also traveled to Kuala Lumpur, but all the doctors say that it's very risky to have operation, and after operation he might become vegetative state, or he might risk. We are not able to see your PowerPoint. Can you show your PowerPoint over the internet? Sister Xianya, can you show the PowerPoint? And she is trying. Oh, can you see that PowerPoint? Can we continue? And Mr. Shi is from Malacca, from Penang. He also went to hospital in Penang, and doctors say that it was very risky to have a surgery, so he didn't have proper treatment, and so the tumor grew bigger and bigger, and so he fell in year 2019 April. He fell down in his bathroom, and the doctor evaluated that he only had a few months of life. And when the family were in this despair, and doctor she grandson study in Tzu, and so his grandson talked to a Tzu volunteer. So they introduced him to Tzu volunteers introduced him to seek for medical help assistance from Dalin Tzu Hospital. So he was when he came to Taiwan, he was in wheelchair, and we can't we he didn't know that what he didn't talk to us. He didn't know what kind of medical treatment he need to went through, but his family had a big hope in upon from Dalin City Hospital, and we also helped them to find a place to stay. We lived in Malacca, and we went up north to Penang, and we also went to Kuala Lumpur. And many doctors say that it's too risky to have operation. So my father, myself, went into vegetative state, or he might die on the operation table. So we were very afraid that for my father to went through this operation. We found that my father, without the proper treatment, he become more ill over the time. And at first, we were afraid to tell our father that at first the doctors say the doctor's diagnosis and estimation was he only have 2 years of life. And after he fell down on the in the bathroom, the doctor said that he only have a few months of life. And at first he say there's the doctors say the tumor, the dimension of the tumor was 3 centimeter, but after we have the exam, we found that the dimension of the tumor was 6 centimeter, and the tumor was in the center of his brain, and it's really, really very risky. But I know that he and his family has no other places to go, so we have to take the risk. And we had the operation for him, a very successful operation. And let's watch the interview. I'm very grateful. I'm very grateful. Because of you, I can stand up on my own feet. And you can continue. After the surgery, he can go back to his home to have the rehabilitation exercise. Now take a look. He can do the rehabilitation exercise, and he's very happy to. He's able to participate in the wedding ceremony for his son. And he is from Malacca, from Malaysia to Taiwan, and had he stayed in Dalin City Hospital for a month, and he regained his health and returned back to Malaysia to join the wedding ceremony for his son. And the next one is the arterial venous malformation, and the tumor is so big. The tumor was so big. It was very risky because the tumor is so big. He suffered from the hydrocephalus. So we have to put into drainage tube to help his.
And we also have a case, from the young people, and he is only 16 years old. He's a boy, and he is a very young boy, a senior high school boy, enjoying sports, and something really unbelievable to him. And from his disease, and let me introduce the story to you. Okay, and his parents thought that he only had a cold, so he fainted. But finally, when he was sent to the emergency room, and they learned that this is very dangerous, and because he had like a dilated pupils, that means he lost the vital signs, and he was very young, and he just was sent to the hospital immediately. So we worked hard and saved him. And his mom said that he just had like a headache, and he just vomited, and I felt that's no problem. But finally, he just fainted out, and he fell off, and it produced like a big noise and shocked me. Therefore, I realized something wrong, and I sent him to the hospital. And he just told the doctor, therefore, that he had a kind of a terrible headache, and and I learned that he is getting like unconscious. Therefore, the doctors saw there's something wrong with the boy, and I was given like a critically ill notice from the doctors, and I just got shocked. Why? Next page, please. And actually, such a disease, and it is that arterial venous like malformation, and so many factors will cause such a disease, right? And because of his dilated pupils, and this is kind of critical, then we had to give him the surgery immediately, and he had the operation therefore, and you will see that we know this is a kind of a big operation, and we needed to send like over 6,000 cc of the blood to him. And the surgery was successful, but we wonder whether he just could wake up or not. And all the medical team therefore did their best and saved this boy. And finally, he recovered, and he stayed at the ICU for over 3 weeks. But we also had a kind of a checkup on her, physical checkup on her, and we cut his like a tumor off, but he had a second syndrome, and it is also a big problem for him. So we had the second surgery on him. So the first surgery was the intracranial surgery, and the second surgery was that we give him the skull, and the third surgery is that we cut off his like arterial venous malfunction. So the clip, please. And this is the whole process that we had the surgery, the brain surgery for the young boy. And then we cut the malformation off, which can prevent him from hemorrhage next time. And now And now this is another interview, and let's see what his mom said. And mom, we know that you are very touched by all the dedication from the medical team. And is there any side effect on your boy? And actually, he is here today. You are Miss Jian, right? And you had the 3 surgeries, right? And I was shocked, really. And how are you now? Good. You can play basketball now? And do you have anything to say, our uncle? I'm sorry, the brother doctors? And I'm very grateful that they saved my life. And thanks to the medical team. And say Happy Father's Day to the young doctor. Thank you. Okay. Bless you. And thank you very much. So you can begin talking now and see it is, what he is like now. And we say thank you to Dr. Wu that gives him the surgery. So he recovered so well now. And this is kind of great. This is a kind of great result that he is so wealthy now, because we thought that he would have been the veggie, or he would have suffered the like a paralysis. Okay, and now let me show you the third case. And this is a problem also in the brain. And this is an 83-year-old volunteer, Mr. Yang, who served in a cycling, like a recycling station. And he was a very important volunteer in the recycling station, because like he does the recycling like every day, and including his wife and including his sons, and they were also volunteers. But one day he fell from the third floor. Therefore, he was sent to the hospital, and through the physical checkup, and we see the hemorrhage in his brain. But this was not a big problem, and we just put him into observation, and therefore he successfully got home. However, when he was home, he suffered from an headache, and his family were worried about his condition, and then he was sent back to the hospital again. And that he suffered finally the urinary incontinence, and he had weak limbs, and finally lost the ability of speaking. And he also had like a sluggish look, and he had a problem on his eye focuses. And we learned that he really had a tumor in his brain, and this was the second time he was hospitalized. And you see the swelling of his brain, right? And now let me show you the image when he was doing the rehabilitation. I fell off from the third floor to the second floor, and I was blooding on my head, and I gradually lost my consciousness, and I even couldn't speak. And I just couldn't speak clearly. And he suffered from urinary incontinence, and he couldn't speak, and he had no reaction when we talked to him. And after I had a surgery on my brain, I gradually recovered. And I also heard that some brain surgeries were not that successful, but that I'm lucky. And when I got home and I served in a recycling station, and when I was assigned, to do some recycling jobs, and I just followed and I did it. And my father received like a careful, like was cared by them very carefully, and so my father can just recover the soul successfully. And I'm grateful that this 83-year-old volunteer recovered so soon. And initially, I thought that he needed like intensive care for like more than 3 months. But I was surprised that he finally showed up in a recycling station just after a month. And I think I lived a really valuable life because I can just save the people's life, and I learned that this like a volunteer now is still participating in a Dharma talk, and I'm so happy. And in the image here, and we see like a volunteer, a patient suffering from the disease from trigeminal nerve disease, right? And this is a 71-year-old lady, and within 5 years, and he got like a pains on her face, especially when she brushed her teeth and cleans her face, right? And she says to me that she suffered from the pain on his face really, really frequently, and she just couldn't bear to deal with this, right? And she thought that she might have some like ache on the tooth or teeth. But finally, we realized that this is all because of his trigeminal nerve. And how painful is she? She suffered from the pain, and finally she found it out, all right? And therefore, yeah, she took the painkillers and she went to the temples, and she had whatever she could, and she just can't recover. Okay, and luckily, and she met the benefactors, and they are the doctors from Tzu Hospital. Okay, and she was here, therefore, and had the physical checkup, and we learned that she got some problems and on her nerves and on her veins. And before the surgery, and she was so painful that she couldn't even put on her mask. And let's take a look. She didn't eat anything. Okay, no, I couldn't. And I just had some fluid like water. And can you close your mouth? No, I can. My mouth like an X. I can close my mouth.
Now the screen is the surgery process. And let's take a look at the interview. And when even the towel touched my face, it would trigger the pain. And when I suffer from the pain, my children were very worried about me. I didn't know that the trigeminal nerve pain is like very painful, like fierce pain, and we couldn't bear to see her suffering from the fierce pain. Good morning. Do you feel better? Do you still feel the pain? If I don't touch it, I won't feel the pain. Thank you. Thank you for your help, doctor. Good morning, doctor. Do you feel better? I feel so much better. Even my grandchildren, they now watch .I TV, watch the .I TV to see doctors from city hospitals to share the medical knowledge. Before she had surgery, she couldn't even bear to open up her mouth to speak, and now she become very talkative because she doesn't suffer from the nervous pain anymore. And you can see that on her face that she felt joyful. And now you can see the joyful expression on her face compared to the to her facial expression before the surgery. And now she is very joyful every day. It's very she even had difficulty to swallow her saliva, and now she could open up her mouth freely to speak. And we only have 5 minutes left. Do I need to continue my sharing? And there's and this case, he was in coma for 60 days, and he had an injury at a car accident, and at first, doctors thought that he would become a vegetative state, and after we help him, and now he recovered and he became a Tzu volunteer. And when he had accident, he was only 29 years old, and he was an electrician. Now after if we could, as a doctor, we will try our best to rescue a patient if we are able to. So he had hydrocephalus. We still need to use the drainage tube in his brain to help the cerebrospinal fluid to be induced, so his brain will be discutant. But I know he is a doctor. He is a father, and his children were still very young. He need to recover to help his family, because he was in coma, and he even he was out from intensive care unit. He couldn't even open his eyes. He couldn't even have any motion. But the doctors say that he's not in a vegetative state. And so he was transferred to Dalin Hospital to seek for medical assistance from Dr. Chen. He lost his the speech capability, so he after rehabilitation exercise and help from Dalin Hospital for 3 years. Now he recovered, although his eye nerves has shrunk, and his the speech ability couldn't recover totally. But at least he's alive, and he is able to he's able to take actions on his own, and he gained confidence in the recycling station. At first, he was in the recycling station just to kill time. But now, after he involved in recycling station, many volunteers took good care of him and encouraged him. Even he couldn't communicate very well because his speech ability was very limited, but the recycling volunteer taught him how to speak and also very interact with him very patiently. Dr. Chen, can you complete your sharing in a few minutes? And this when Mr. Wen Chen, in after he worked in recycling station, he recovered even faster. And he also participated as a volunteer in Dalin Hospital, and he also returned back to as an outpatient as a case to my clinic. Now he grasps all the opportunity to pay back to the society, and he is able to expand his potential. Although there's inconvenience in his body, but he is still able to pay back to the society and become a person who is very influential, not only to and very encouraging to volunteer in the recycling station. Thank you for listening to my sharing. Let's give a big hand to Dr. Chen. From now on, I'll call you Brother Chen. Yeah. I know that Dharma message is at City Dalin Hospital, so that you are not able to, you want to be by the side of Dharma message, and you are not able to visit us today physically with us, but you share your experience online. Thank you. For over 2 decades, you worked very hard and Dalin City Hospital. Even when City Dalin Hospital just first established, everything was not ready. The resources were scarce, but you were not afraid of any difficulties. For in coma for 60 days, the volunteers, the volunteer Wen Chen, he was in coma for 60 days, and now he recovered and he could become, he gained back his motion ability. He can walk and take actions on his own, and we can see that Dr. Chen, he is not very good at speech, but giving speech, but he is very emotional and he is very compassionate. You can see that from when he's sharing about the brother Wen Chen's story, that his patient that was suffered in coma for 60 days. When he mentioned this patient, he still tears in his eyes. He still have the feelings for the suffering of his patients. Dr. Chen is a very compassionate doctor and very kind. He treated all his patients like his family members. And he's the coolest Dr. Chen. He's the coolest doctor I've ever seen. He very seldom smile. And now I mentioned that you very seldom see his smile. Now he's smiling. You can see that on the screen that he's smiling. His smile is very cute. And many people suffer from chronic illness, and we're just like seeing a light at the end of the tunnel, that our chronic there's a rescue to our chronic illness and disease. After the treatment of Dalin hospital doctors and medical staff, many patients have recovered. Very kind doctors from Dalin Hospital. The tumor was 6 centimeters large in dimension, but Dr. Chen overcome all the difficulties to help the patient